I'm Dr. Sarah Hurvitz, Professor of Medicine and Head of the Breast Cancer Clinical Trials Program at the University of California, Los Angeles, Johnson Comprehensive Cancer Center. The use of hormonally targeted agents for ER-positive breast cancer of any stage has profoundly improved outcomes for patients. So it's a critical component of the treatment that we give in both the curative setting and in the late stage setting, where our goal is to control the disease and improve long-term survival. Uh, Usually, we do not give endocrine agents or anti-hormonal therapy concurrently with chemotherapy. There is some notion that doing the combination approach will be antagonistic, meaning you'll get less benefit from the chemo or the hormonal therapy by combining them. And there was one study in the 80s and 90s that suggested this was the case. When you use, for example, tamoxifen concurrently with chemotherapy, patients tend to do worse than sequencing the chemotherapy followed by the endocrine therapy, and this is for the early stage setting. Other studies haven't been so certain in that result, especially in the HER2 positive, hormone receptor positive disease setting. There doesn't appear to be antagonism, but we have a few clinical trials indicating that they aren't synergistic or additive, that adding the hormonal therapy with chemo-based approaches doesn't add benefit for patients. And so based on this compilation of several trials, many of us will choose to sequence and utilize in the early stage setting chemotherapy, which is usually only about 4, maybe 5 or 6 months at the most, followed by longer-term anti-estrogen therapy, which is usually at least 5 years. And in the metastatic setting, if it's hormone receptor positive breast cancer that's HER2 negative, our first approach is going to be the opposite. It'll be hormonally directed approaches, usually in combination with agents like CDK4/6 inhibitors or PI3 kinase pathway inhibitors. And once a patient's disease has gone through those agents and has developed resistance to that therapy, only then do we usually turn to chemotherapy-based approaches. On occasion, we will feel the need to use chemo before hormonal approaches in the metastatic setting, but that's a rarity now, given the activity of the targeted therapies that we have available for ER-positive breast cancer.